Friends, a good Wednesday morning to you at 8:30, and thank you for tuning into Real Talk. I'm Ryan Jesperson. Big afternoon yesterday, wasn't it, as the province of Alberta, the Alberta government, by way of Premier Jason Kenney, a couple of his senior cabinet ministers, Minister Chandra, Minister Schweitzer, and, of course, Dr. Dina Hinshaw, announcing new measures that the province will take in order to try to stop the surge of COVID-19 cases that we've been seeing. We're going to get into what the restrictions mean for you. Many of them coming to effect this weekend will likely have an impact on you. Perhaps you're one of those Canadians that's already been voluntarily hunkered down. You've already been voluntarily locked down. Perhaps some of the restrictions or all of the restrictions announced yesterday have no relevance to you because that's the way that you've been rolling for the past number of weeks or months anyway. After all, we've been talking about personal responsibility, haven't we, in the province of Alberta? And that is a thing. I want to have some real talk today on whose job it is and whose responsibility it is, or perhaps we should simply say who should be taking responsibility for the surge in cases we've seen, for the numbers we've seen. This can get politicized quickly, and it does, and it makes sense to invoke politics here because that's where public policy emanates from. But perhaps, as former Alberta Premier, the late Jim Prentice, once said as well, we do need to look in the mirror and have meaningful conversations about how we've approached this pandemic and how in Alberta, across Western Canada, and across our great nation, we'll be approaching the next 4 weeks or so, with hospitals, frontline staff warning that we are very nearly close to capacity. We're going to talk to a COVID survivor today. You may roll your eyes and say survivor. Everybody's using that word now for everything. You're a survivor. Jaclyn Robinson is a survivor. She barely made it out the other side. She's a public health nurse out of Vancouver. She's going to join us in about a half an hour's time. Before that, we're going to talk to health researcher out of the University of Calgary, Dr. Sajjad Fazel, and we're going to check in with Tristin Hopper of the National Post coming up a little bit later on in this broadcast. If you know Tristin, you know that even I have no idea how that interview's about to go, but I guarantee you this, it'll be wildly entertaining. And then we want to let you know, and we'll be reminding you through today's live broadcast, that even though we're typically not on the air at 2:05 p.m. Mountain, 4:05 p.m. Eastern, we will be today. We don't pre-tape on this show. It's a flag that we've planted. In other words, whatever you see here on this show will be live. We requested a conversation with Canada's finance minister, Deputy Prime Minister Chrystia Freeland. Her team said she'd be happy to make her debut on Real Talk, but she can only do it at 4:05 Eastern. Would you pre-tape? I said, gosh, we don't pre-tape. And then, well, it occurred to producer Sam Brooks and I that we can go live whenever we like. So why would we pre-tape? We know you can do whatever you like in the middle of the afternoon, especially these days, so don't miss today at 2:05 Mountain, 4:05 Eastern. We'll be back on air. It may only be 10 or 12 minutes, but a special live edition of Real Talk as we go one-on-one in an exclusive sit-down with Canada's Deputy PM, Chrystia Freeland. That's coming up. But first, want to let you know that we have this ball rolling this morning because we've got the amazing support of the team at Bitcoin Well. As our presenting sponsor, Bitcoin Well makes sure that we bring you what you're looking for every day as they bring you what they provide, which is the easiest and safest and most hassle-free way to buy and sell Bitcoin. You can get Bitcoin gift cards. If you're looking for that perfect stocking stuffer, or quite frankly, you just want to get in the game, talk to the team at Bitcoin Well. They've got Bitcoin ATMs across the Metro Edmonton region, across Canada, in fact, but they're proudly headquartered right here in Alberta's capital city. Sam, let's get her going.
Real Talk starts now. Here's Ryan Jesperson.
We also want to make sure that you know about our new partnership with Y Station. Y Station is the official research and strategy partner of Real Talk. And yesterday, by way of my Twitter profile, on my Facebook, and at RyanJesperson.com, right up there in the top bar, you'll find the question of the week. We're calling it Get Real. Here's your chance to have your say on this show. We want to know about you. We want to know what makes you tick. We want to know how you feel about issues that matter. Ultimately, we'll create our Real Talk panel. Don't worry, it's not a huge commitment. You can participate as you see fit with whatever works with your schedule. But we'll be gleaning detailed data about our audience and about the Canadians that tune into this program. And each and every week, we'll be able to take a look at questions and answers provided by you on issues that matter most to Canadians. We're very excited about that partnership, and we invite you to sign up today to have your say. Again, you can find it very easily on the top bar at RyanJesperson.com. Dr. Sajjad Fazel in just a moment, but first, let's take a look at a brief, we're going to play about a minute right now of what Premier Jason Kenney had to say yesterday. Now, this was basically Premier right out of the gates at the podium. And I don't know if you're like me. If you are, you probably read in quite a bit to what you're watching. You pay attention to things like body language. You pay attention to things like posture, and you pay attention to eye contact. You pay attention to the delivery of a message as well as the message itself. What I thought was particularly interesting about this, and nothing that Premier Kenney says in this clip is incorrect. As a matter of fact, his speechwriters, I think, did a pretty good job of getting out the message that they want to get out, including the fact that Alberta was a respected enough jurisdiction in the perspective of health that the National Hockey League brought a number of teams here, 12 teams here back in the bubble days into the hub city, you'll remember, for the NHL playoffs. Alberta was the talk of Canada at the time. Now, it hasn't stayed that way, has it? But if you listen to Premier's message yesterday, there's some real political elements to it. We'll get into this in just a second, but first, let's tee it up.
Despite all of the pressures that we have faced together, we managed to get through most of this tough year with lower relative levels of COVID infections, hospitalizations, and fatalities than the other large Canadian provinces, all the U.S. states, and pretty much all of the European countries. And we did that with a lighter hand on job-killing restrictions, while also coping with the hardest hit Canadian economy due to the energy price collapse on top of the global COVID recession. And we did it while leading Canada in pandemic response, from personal protective equipment that we were able to share with the rest of the country, to the highest levels of testing, to the fastest and smartest use of technology, and much more. Let's not forget that the NHL recognized Alberta's leadership by choosing Edmonton as the center for the NHL playoffs of dozens of cities across North America. But having said that, we all know that the last few weeks have been a different story.
So that's Premier Jason Kenney there. We know the last few weeks have been a different story. You heard him talking about job-killing restrictions. That's one example of how the Premier, I think, wanted to clearly communicate to Albertans tuned in to that 4 p.m. update yesterday that there is a political element to pandemic management. Obviously. Now, the question is, again, is it fair to look back on the government right now? I've heard some people saying, I've been paying attention to my social media channels and doing as best I can to have my finger on the pulse. I mean, nothing's better than the comments you're going to leave this morning on our live YouTube stream or using the Real Talk RJ hashtag powered by Park Power. But it seems that some folks are saying these are the appropriate measures. This is the appropriate period of time, the next 4 weeks. Others are saying, too little, too late. Now, that's a bit of a pessimistic view in my mind. You don't simply say too little, too late and dismiss the entire restriction. I think it's important that we talk about the validity of them, whether or not they're on point right now, and if this will help Alberta course correct. But the politics of a pandemic are a fascinating area for discussion, and that's exactly the platform we have here this morning. So we want to hear your thoughts. Also, very curious to hear what our next guest will say about this. He's a health researcher at the University of Calgary, a public health researcher studying and addressing COVID-19 misinformation. Dr. Sajjad Fazel making his Real Talk debut this morning. Doctor, thanks for making time for us, and welcome to the show.
Thanks a lot. It's good to see you back on air.
Thank you. What did you make of the restrictions announced yesterday? I'll keep the question vague and general out of the gates on purpose.
Yeah, it's needed, Ryan. It was needed a little earlier, and I think it's late. But at the same time, it's not something we have to disregard. It's something we have to keep in mind. I think it's needed now. And if we can correct the course, if we can follow these recommendations, if we have peace officers and the police enforcing these recommendations, then I think we can start the new year much brighter, right? Think of it as if we are at war, right? Think of it as Alberta is at war with the virus, with COVID-19. And each of us, me, you, and everybody else, from doctors to frontline workers, we are all the troops fighting this war, right? And we know that the vaccine is coming. That's like the Air Force that's going to nuke COVID-19, right? And what we need now is our resolve. What we need now is to rely on each other. And the restrictions, although they are late, that's like the reinforcement of the ground troops. So if we can make sure in this next month we are following these recommendations strictly, we can turn it around and we will be at a much better place as 2021 rolls in.
Doctor, is 4 weeks an appropriate period of time? It strikes me. We talked about we saw the CDC yesterday announcing they're dialing back their recommendations a bit, or at least the limitations on self-isolation. They say that if you've been exposed to somebody with COVID-19, but you show no symptoms, a 10-day isolation or a 10-day quarantine is appropriate. They say if you show no symptoms with a negative test, a 7-day quarantine would be appropriate. But the CDC did point out yesterday that it is still the safest approach to continue to observe the 14-day quarantine. These limitations put in place by the Alberta government yesterday will last for 28 days, 4 weeks. An appropriate period of time in your estimation?
Absolutely. I think we have reached a very severe stage. One thing that we have to understand is when we were at a very dire situation in May, the restrictions were very, very strict. Where we are now, we are worse than where we were in May in terms of the number of new cases and active cases and deaths and positivity rate in the population. But the policies have not reflected that. So we need this now. This is like a circuit breaker. This is like us saying, we're going to take this war back and we're going to win this battle. And I think it's time for all of us as Calgarians, Edmontonians, and Albertans in general to say, let's use this opportunity, this golden opportunity. It's not easy staying away from family during Christmas, but this is the time. If we can buckle up, we'll be able to change things around in the new year. Definitely.
Doctor, I know that much of your health research has come down to myth busting, essentially, and there's been, I think, many different opinions, assertions about vaccines. Now, I know opinions about science is kind of a counterintuitive. I mean, just even the whole idea, it's like opinions about evidence. It doesn't matter your opinion about gravity. It applies. But there have been many different opinions and takes on this vaccine, specifically the one that Pfizer has developed that'll now be available. We expected the first dose here in Alberta momentarily. We know about 2,000 Albertans by the end of the year, and then we expect through the spring, thousands of Albertans will have an opportunity to get vaccinated. What are some of the key things, the messages that you're focusing on as you follow the news about vaccines now almost available?
Yes, I think, you see, there is no point in having a vaccine if people aren't ready to take it, right? And that's something we have to understand is important. There are a subset of the population, there are Canadians who say that I will wait and see. And I don't think that's the right approach. And when they say wait and see, they're like, you take it first, let me see what happens to you, and then I'll decide whether I want to take it. I think that's very wrong, We have the vaccine, we should be taking it. Now, by default, some people will already be in the wait group because we don't have enough doses to inoculate everyone. So I think use this time. If you are not in the first group of people, in the first set of people to get the vaccine, use this time to see. You said you want to wait and see. And I would say the media should focus on interviewing people who have taken the vaccine to reduce the hesitancy that's there among people, because there are people who are afraid, oh, this is a new vaccine. Although I want to make it very clear that once Health Canada approves the vaccine, they've already checked the data in terms of the safety and of efficacy. And that's why they would approve such a vaccine. So I think this is something we have to understand. The other thing, Ryan, I want to mention is side effects. A lot of people say, oh, there's going to be side effects of the vaccine. Well, everything has side effects. This Advil, for example, even has side effects. Every medication you take has side effects. That does not mean you do not take it, right? You're looking at the benefit-risk ratio over here. What are some of the side effects of the Pfizer vaccine, for example? You might have some pain in the arm where you took the injection. You might have a little bit, 1% of those in the trial had vomiting, maybe a little bit of fever, some fatigue. Now compare that to getting COVID-19 and all the symptoms associated with COVID-19 and how that's going to affect your life, right? So I think we have to be clear. It's not a utopia, but at the same time, we have to make it clear it's safe, it's effective. There's going to be some small side effects, but the benefit far outweighs the small side effects.
I think one of the interesting things that I've been noting, Doctor, and I don't have specific data in front of me with regards to polling, but I've seen it. So anecdotally, let me present that, I would approximate that, the hardcore anti-vaxxers among us, the people that don't inoculate their kids, they don't get the vaccine, they sure as hell don't get the flu shot. They believe what Jenny McCarthy has to say over health professionals. They believe the Hollywood celebrities that allege, for example, that autism comes as a result of vaccines, which has been soundly disproved, et cetera, would be a relatively minute portion of our population. Let's say under 1% to perhaps a maximum of 3 or 4%. However, the vaccine hesitant in this circumstance relating to COVID-19 flirts with 35 to 40% of society, depending on the studies or the polls that you look at. That is not a number we can ignore. So what's your message to the vaccine hesitant that might simply be saying, hey, I don't know a ton about science. I only want what's best for my family. And it seems to me that this thing is really, it's obviously being fast-tracked. The mandate is to fast-track it, but I wonder if that might mean that they skip some steps. They're not aware of the long-term effects. Maybe we're putting ourselves in harm's way. What would you say to these people?
I would say that that's not something to be worried about. We understand, and as health researchers, as health professionals, we're empathetic that somebody might fear something new, might fear that this was fast-tracked. But the fast track did not come at the cost of quality. And that is something to be understood. The technology of creating this vaccine, and this is a new type of vaccine, the technology has changed from what it was in the past. And so this is why it was possible to fast track. That's the first thing to understand. The second thing is that it has gone safety and efficacy studies throughout the clinical trials. At the same time, before getting approval, and it undergoes independent research review, and then it undergoes review by both the US Food and Drug Administration and over here in Canada by Health Canada, who ensure that it is safe and efficacious. And a lot of people, Ryan, I've seen have this notion that it might cause side effects. But as I've explained, these are some of the side effects that have been seen. And had there been something severe, a severe adverse reaction, this wouldn't have passed the safety tests. And so this is something we have to keep in mind.
Doctor, if people aren't following you on Twitter already, I implore them to do so. I've linked to your account on my profile when we announce who's on the show today, at Sajjad Fazel. I liked this tweet yesterday. You said, when the COVID-19 vaccine rolls out, I want everyone who gets the shot first to share their story in the most creative way on social media with follow-ups. You say, and I want the media to interview them periodically. You say this will help reduce the hesitancy and concerns that many have. I responded to you by saying I'll gladly get the vaccine live on the air here in our studio on Real Talk, and I mean it, and we'll do our best to make that happen. Want to set a positive example, and I'm happy to get that vaccination. Why do you think it's important to invoke people's social media posts? Why does personal testimony matter so much here?
You see, Ryan, a lot of people who are hesitant, it's also because they hear it from family and friends, they hear it from colleagues at work. And I think at the end of the day, we are all human beings, and that human touch does matter. If you see somebody within your own circle sharing a story that they got the vaccine and they are okay, and then they give follow-ups that they have not had any severe side effects apart from maybe some pain in the arm or something like that, it's going to help reduce that hesitancy. It's going to increase the trust. So it's not only about us as health professionals spreading this message, but it's also about cousin Mark and Lucas helping others in society by saying, you know, I took the shot, or I was lucky enough to get the shot, and this is what happened, and this is how it is beneficial. It's a community thing. We should think of it as together as a nation, we are encouraging each other, and this is one way we can beat these fires.
There are some suggestions that as the months roll on and as the vaccine is readily available and as people perhaps, I mean, to put it plainly, run out of excuses for not getting vaccinated, and obviously it's a personal choice, I see people suggesting that those who have not been vaccinated should be barred from boarding public transit, should be barred from entering public spaces, that children that have not been vaccinated should be prevented from entering public schools, libraries, etc. You can use your imagination. And it's gone so far because this is what happens on Twitter, for people to invoke the treatment of Jews by the Nazis in World War II, the star, so to speak, the Star of David on the arm. And the conversation can get very hot very quickly. How do you believe that society, what public policy do you think should be implemented to reflect how this needs to be managed? The vaccinated and the unvaccinated walking together.
So I think it's a very delicate issue, as you have mentioned. But we do know for a fact that you cannot visit certain countries, for example, without getting a yellow fever vaccine, right? That is a fact, and that is currently available. You cannot, for certain schools, they need your child to be vaccinated unless you actually have an exemption. And I think for the time being, until at least 80% or over 80% of the society has been vaccinated, until that time, I don't think it's fair enough to say whoever has not been vaccinated should not access certain services, because right now we don't have enough vaccines to roll out. However, Ryan, when we reach that part where almost 80% of the population is vaccinated or more, and the only people who are not vaccinated are those die-hard people in society who say that I do not want to be vaccinated because I don't believe in this, I think then at that time you can have restrictions such as those, because at the end of the day, it's about the safety and well-being of everybody.
Yeah, I mean, I won't be surprised to see. I mean, geez, it's kind of hard to imagine because typically personal health matters are exactly that, right? They're very personal. But I can imagine a day when, for example, airlines may say you're not boarding the aircraft unless you have proof that you're vaccinated. That's just one example off the top of my head. Can you see that happening?
Not in the near future, but going ahead, maybe a year to two from now, yes, definitely. I mean, there are some countries right now, Ryan, that you can't visit without a negative COVID-19 test. So I do see this developing in that way. And these are private businesses. They can definitely impose such measures.
Yeah, I'm curious to know what our audience thinks about that, and we'll be keeping an eye on the Real Talk RJ hashtag as well as the live comments here on our YouTube channel with many people watching live right now. Dr. Sajjad Fazel, our guest. Doctor, before I let you go, before I thank you for your time, are there any pervasive, I mean, to bring this back full circle, your work around myth busting, your work around public education, which is so important. I mean, you mentioned bylaw officers and enforcement earlier. I think you and I would both agree. Please feel free to disagree. But I think we'd both agree that education will beat enforcement every time if you want mass buy-in, or at least from a smart place to start. Are there any pervasive mistruths, inaccuracies, or full-out myths that you continue to see as part of public discourse that you'd like to address while you have the attention of our audience right now and the attention of those listening to the podcast later in the day?
Surprisingly, Ryan, till today there are people who believe that COVID-19 is just as the flu. There are others who still believe that it's a hoax. It's surprising. It's surprising to me as well that we still have people believing in that. And that is something we're going to continue, educating and dealing with. People who say wearing a mask takes away your freedom, which is wrong. So I think these are things we're going to continue seeing. But my message for the majority of listeners will be, let us use this 1 month that we have in Alberta. These restrictions are in place. Let us use this time to make sure we start 2021 better. Let us follow the restrictions. And if you are among those people who are first in line to get the vaccine, either in a long-term care home or a staff who's working in those areas, then make sure you take your vaccine and instill confidence in those who are maybe slightly afraid.
Doctor, I'm going to ask a completely unfair question to end our interview, because there's no way for you to really accurately answer this. But what's your general time frame? Now that a vaccine's on the horizon, now that governments have procured the vaccine, at least the first shipment, now that there are plans in place to get the vaccine to the different provinces, now that we know who's going first, et cetera, what's your prediction for when we can be back, as Sam Brooks and I have said, bumping chests in bars, at hockey games, spilling beer on one another, packing movie theaters, listening to our favorite bands at concerts, cheering on our favorite NHL team with 18,000 other people around us, big kids' birthday parties, sleepovers. You get the idea. I'm jonesing for this.
Quit dangling that carrot in front
I know,
of us.
Sam. I'm trying
nice.
to. I cannot temper my enthusiasm when it comes to getting back to normal. So, Doctor, a completely unfair question, I acknowledge. But when?
Yeah, that is an unfair question. It's hard to see how things go. Let me just say this. In an ideal world, if we could get the vaccines out to everyone and we could all follow restrictions, it would have been much sooner. However, the way things are going right now, probably sometime in 2022, I would say.
Yeah, January 22. I know you didn't say January.
Well,
I know you didn't say that. And you're not on... I was going to say you're not on the record. I mean, technically you are on the record, but we'll take it as an off-the-record comment. We'll treat it as such. Let's just say our fingers are crossed. The more public buy-in we have, starting with this 4-week, no one wants to call it a lockdown, but let's call it what it is. These 4-week measures, let's hope that we can turn this tide. Dr. Sajjad Fazel, keep up the incredible work. Thank you for making yourself available to us this morning. We appreciate it.
Thank you, Ryan.
Dr. Fazel is a public health researcher out of the University of Calgary, and his Twitter game is strong. I encourage you to give him a follow. In just a moment, we're going to get to the news headlines. Then we're going to talk to Jaclyn Robinson. Jaclyn and I, as a matter of fact, went to university together about 25 years ago, if you can believe it. And I was among the thousands that experienced great distress. No one more than her kids, her husband, her family, when she spent about 10 days in a coma after contracting COVID-19 previously this spring. She's going to be talking to us. We wanted to get a sense. We talked to Erin Ross, the artist, earlier this week, who's about a week and a half removed from her fight with COVID-19. Jaclyn Robinson, she's a public health nurse, is now several months removed. And we wanted to get a sense of how it continues to impact her, what it means for her daily life, and how she's giving back now. She's always contributed to the healthcare system for about 20 years or so as part of her profession. But she's really ramping up that commitment. It's getting a little bit more personal for her as she's able to provide data as one who has made it through the other side. Before we get to the headlines, we want to recognize a couple of our sponsors, the partners, the builders that keep Real Talk on the air each and every morning, and that includes the team at Sherwood and St. Albert Dodge. You know, I'm gushing all the time about this 2020 Jeep Grand Cherokee that I'm driving. Absolutely love it. We've been a Jeep family for many years. My first vehicle was a Jeep. My second vehicle was a Jeep. My third was a Jeep. You get how this is going. My wife's also got a Jeep Grand Cherokee. We love them. We trust them. And there's no better vehicle to get you through the winter conditions here that we experience in Canada than a Jeep. Sherwood Dodge, St. Albert Dodge, your number one Dodge and Jeep dealers in the province of Alberta. Swing on by, give Scott and his team a call over the phone. They're eager to help you out and, of course, observing all COVID-19 safety protocols. We're also thrilled to have the support of Friesen Brothers on this broadcast. Friesen Brothers soon to open their 15th store just off the Anthony Henday, Rabbit Hill Road, you know that area in southwest Edmonton. It's a stunning shop. I had a chance to tour it just the other day with company founder Frank Loveson, and they are so excited to open the doors on that store this spring. In the meantime, there are other 14 stores across the province. Their Red Seal chefs are ready to take the Christmas and holiday planning pressure off your shoulders. Whether you're looking for turkey and fresh Alberta produce or something else, including their world-famous sourdough, why not leave it to the team at Friesen Brothers, Alberta grown and Alberta owned. Jaclyn Robinson coming up in just a moment, but right now let's take a look at what's dominating the news headlines here in Western Canada and, of course, across the country. Eyes on Alberta, and we hope, as citizens here, if you're watching from Alberta, if you're watching somewhere in Canada or somewhere else in the world, it goes without saying, we're all hoping to see these numbers plummet and ultimately hit the floor. Let's take a look at Alberta's numbers as of yesterday's update from Alberta's Chief Medical Officer of Health, Dr. Dina Hinshaw. As you know, more than 20,000 active cases of COVID-19 in the province. That includes 112 as of yesterday in ICU. That's up 600% since the end of October. 600% in the last 6 weeks or so. The 7-day average of new cases in the province, almost 1,800, and 640 Albertans have died after fighting COVID-19. So what do these restrictions mean for you? As announced yesterday, well, here's how it's going to play out. Beginning on Sunday and remaining in place for 4 weeks, of course, through Christmas, through New Year's, effective immediately, indoor and outdoor social gatherings are prohibited. Forget about the backyard campfire with the neighbors. Forget about getting the kids together on the toboggan hill. It's canceled. Masks are now mandatory across the province in all facilities outside the home. Alberta, up until yesterday, had been the only province without a mask mandate. Starting Sunday, and this may have an impact on your holiday shopping, keep in mind all the local retailers that are doing everything they can right now. They're doing home deliveries, curbside pickups. These are the independent businesses that are fighting like hell to survive. Keep them in mind over these next couple of weeks. Retail services and malls will be reducing customer capacity to 15%. Restaurants, pubs, and bars are now closed to in-person service, but takeout, delivery, and curbside pickup is allowed. All of these personal services facilities, hair salons, nail salons, casinos, bowling alleys, gyms, movie theaters, libraries, museums closed. As of Sunday, places of worship limited to 15% of fire code occupancy. I'm curious to know how you feel about that one. I know people tread lightly around matters of religion, but in my mind, I think that the most responsible thing that a religious community can do right now is agree to meet remotely. I don't think that's a controversial statement. It blows my mind. I understand people's religious practice is very important, but we've heard from the great religious leaders of our time, and I'm not talking about pastors and priests and bishops. I'm talking about the people that they wrote the books about. I'm talking about the people that would remind you that you don't need to gather in church because you are the church, and where two or more are gathered, and you know all that. I'm getting off track, Sam Brooks, but I can't help myself. Places of worship, 15% of fire code occupancy. All employees are required to work from home now unless your employer determines you need to be at work in person. And of course, you can find a full list of all restrictions at alberta.ca. That's what I'm reading from. That's the Alberta government's official website. Let's get to our next guest. As mentioned, she's a personal friend of mine, has been for more than 20 years. She's a recent COVID-19 survivor, a public health nurse in Vancouver, BC. She has emerged from her own harrowing journey with this virus and is now working on the COVID file for the province of British Columbia. Jaclyn Robinson making her Real Talk debut. Welcome to the show, my friend. Thank you for making time for us today.
Thank you for having me, Ryan.
I'm
so happy to be here.
You know, people, you and I spoke several months ago, and many of the people that are tuned in right now, Jaclyn, are remembering you telling your story, and they're eager for an update. I know people will be happy to see you looking healthy, but looking healthy isn't always an accurate representation of how you're feeling. For those that don't know your story, though, Jaclyn, why don't we quickly summarize what your fight looked like. It was back last spring, right? Spring of 2020 when you started experiencing symptoms and then things ramped up quickly.
Absolutely. So as a quick recap, I found out I was COVID positive on March 17th after my husband actually came down with symptoms about 5 days prior to. And I'm a nurse in BC, so I got tested right away and it came back positive. And I stayed at home, isolated. I felt extreme like aches and pains and fever, and I became short of breath. And day 6 of my illness, my husband called the ambulance. I was so short of breath, I couldn't even get through a sentence. Ended up on a ventilator at Vancouver General Hospital about 6 hours later. And I was in a medically induced coma on a ventilator for 7 days. And then I was in ICU for 10 days, in the hospital overall for 2 weeks. And I was discharged April 3rd in a wheelchair, unable to walk. I was so weak. So this virus really took me by storm.
When you start talking about a ventilator, medically induced comas, transport by wheelchair, because you as a young, fit, otherwise healthy human being, I think that it paints a really clear picture. Now, of course, you made it through the other side and you survived. And I don't think it's too dramatic to suggest that your survival at one point was hanging in the balance. But then your second journey began. I mean, I remember you telling me months ago, Jaclyn, that it was a victory for you to be able to walk to the end of your block. Where are you now?
Oh, yeah. So this has been a crazy chapter of my life. And your interview I still listen back and I was short of breath during that interview. I remember even talking was an effort. So for the first 3 months after being discharged, it was work to regain my strength. I did a lot of rehab, shortness of breath. I lasted for at least 3 months. So I was just, my husband and I would just do little walks around the block, like start just literally down the alley and come home and sit again and then keep going a little bit farther every day. So I did virtual physio and I saw a lot of specialists to see how my lungs were doing. And that's what sort of led me into this next chapter of life as being sort of COVID positive, the beginning of this journey. So much was unknown still at that time. And as a patient coming home, trying to make sense of things as a nurse, no one had any answers for me. So that's kind of where I'm at now, is I'm just like all things COVID. So it's led me into a lot of amazing, fulfilling work and research that I'm doing with COVID.
I want to ask you about that. Let's get a sense first of what's allowing you to speak today, in a sense that I noticed a difference compared to when we spoke before. I almost felt guilty talking to you before because it was obvious that you were battling. I mean, I think our audience would be interested to know, Jaclyn, that when you and I did our interview, through me, a national reporter asked to speak with you, and you, although willing to get your story out, told me that you needed recovery time after our conversation, which really painted a clear picture to me. Are you still, I mean, through the physio and everything else, are you still experiencing things like shortness of breath or residual effects with regards to your everyday life?
Yeah, so just to give you some perspective, my CT scan, which is shows your lungs, at the time I was interviewed with you first, was basically a big whiteout, and that's called ground glass opacities, and it's just like all this inflammation in my lungs, and it was very scary to see, and that's this COVID pneumonia that they talk about. And I had a CT scan 3 months after that, and it's about 60% reduced, and I'll have it again in a year. So my lungs are still inflamed, and they still have some ground glass, they call it, which is this COVID inflammation. So I do feel shortness of breath on stairs. I can walk long distances, but stairs, just that exertion, I get chest pain with deep exertion in my lungs. So I do still feel it there. And my energy is not quite back to baseline. It's almost there, but I'm working full time. I'm caring for 3 children. I'm doing lots of things COVID related in my own time as well. So I think I'm hanging in. So
yeah, well, you're doing more than just hanging in there, my friend. But I think that I think that paints a clear picture. I mean, we're coming up on 9 months since your diagnosis, right? We're coming up on 8 months approximately since you were discharged from hospital. The fact that you're still short of breath climbing stairs, I think, gives us a sense of what that might be like. Has your physiotherapist, has your physician given you any sense of whether or not they think ultimately you will get back to 100%? Or is there a possibility that you may experience lifelong reminders, let's say, of this?
They are hopeful for full recovery, but they don't promise anything as they don't know. I'm in a lot of studies looking at the short and long-term impacts of COVID. So they're actually assessing me at 3, 6, 12, 18 months and 2 years. So we'll see sort of the progression. I feel like I can do most things physically now. My muscles, I was able to gain my weight back because I lost almost 12 pounds being in the hospital that long. But we are studying what's happening in the long term with COVID. And that's a lot of my work now, is working with people who are significantly suffering, even more than myself, with these prolonged symptoms that we're seeing. So it's really interesting what's happening worldwide with that.
I think people will be interested for insight if you could pull back the curtain on this interdisciplinary clinical COVID network. This is something that you signed up for basically a month after you were discharged. I mean, to say it again, to reiterate it, before you were able to walk to the end of the block without losing your breath, you were already participating in this network. Obviously, you're contributing your personal experience. You have a 20-year background in public health. How is this all working, and what does this mean for everyday citizens that are watching or listening to this right now?
Absolutely. So it was kind of exciting where public health was calling me every day after discharge, and they were learning a lot about me as I was learning from them. And they realized, I got on the phone with the doctor and she's like, Jackie, I'm taking like 2 pages of notes here on discharge. And I realized that you're a young 42-year-old with a husband who could care for you. But what if you were 78 and a senior by yourself? And we had discharged you and you're in prolonged quarantine and you're still short of breath and so forth. So she's like, we need to figure out supports in Canada for people after hospitalization of COVID. And I was like, I am so wanting to help with this because my background in nursing and complex discharges, I was like, yes, I don't want people to go through what I'm going through now. So I joined the Interdisciplinary Clinical Care Network, which is a provincial network of physicians, specialists, and academics, researchers. And basically, we've set up the first of its type in Canada of these post-COVID recovery clinics. And hopefully, Alberta and other provinces will sort of take all the research we've done. We actually worked with Mount Sinai Hospital in New York, sort of studying how they're following post-COVID patients and figuring out how to do that best here. So it's an amazing service now that we see all hospitalized COVID patients, and they have standardized care. So we see them at 3 months, 6 months, 12 months. They have rapid access to specialists. And doctors Canada-wide can learn from this. They can reach out. They can figure out what tests we're doing now, all the research we've done. So I think this will help nationally. And it's just so exciting to be involved in this.
Well, it's an incredible opportunity for you, and what a meaningful contribution. I mean, the researchers, we're grateful for researchers. I'll note as we're speaking now live, Jaclyn Robinson, my guest, Health Canada has just announced, this is breaking news if you're listening to us live this morning, Health Canada has approved the Pfizer vaccine, and the federal government is expecting about 250,000, look at your face, about 250,000 doses to be available by year's end. What does this vaccine mean to you? That resonated personally. You just acted like your beloved Vancouver Canucks scored a goal.
So being a public health nurse, vaccines are like my bread and butter, right? So it's a science I truly believe in. And I immunize children all over our province and specialized populations. And I have been studying this COVID vaccine from the beginning and working with specialists who also have. And it's just so exciting that we have some hope here. We have another tool, the most important tool in our toolbox to take on this virus. And I love the strategic direction of what's happening with which population would receive it most, like first, which would be in long-term care. And that, as you know, has just been so exposed and hit so hard for these families and staff and residents. And I just am so excited that they get an option to protect themselves from this virus, because they're a population that just can't fight it once they get it. So I'm just so excited. I'm being in public health. I'm already doing case and contact tracing on the weekend as well, just to help out, because I just am phoning cases now, telling them how to isolate. But everyone's asking, when will this vaccine be out? And I'm just so excited to have an answer, and also to help with the deployment of that in our province, and like, how can we strategically get it out to the right populations and get people informed with the proper information. So
back to the vaccine in just a moment. I'm curious, this is a bit of a personal question, but when you're talking to people, when you're on the phone with people, you're doing this incredibly important contact tracing work, et cetera. Do you disclose your personal journey to the people you're on the phone with? And if so, what impact does it have on them?
That's a good question. I'd like to think with my clinical judgment, I would bring it into the right conversation at the right time. So it doesn't need to be in every conversation. However, sometimes I am calling people who are really needing that empathy and they are really struggling. And what's beautiful about case and contact tracing is we're calling these patients every day. So we build a relationship. So often it can come out in the second or third conversation. And I'm like, I hear you. I actually had COVID and I significantly was impacted. And I was short of breath like you and isolated from my kids for, a prolonged period of time. And I was scared. And they're like, oh, so they can all of a sudden the information translates differently. When you put a story to information, it's amazing the difference.
Obviously, your eyes lit up when you heard that just a few moments ago, Health Canada's just announced that they've approved the Pfizer vaccine. You call it your bread and butter as a public health nurse. I just spoke with health researcher Dr. Sajjad Fazel at the University of Calgary before I talked to you, and got his clinical take, or got his, as a scientist and a researcher, his take or his message on what he would say to the vaccine hesitant in Canada. I'm not talking about the anti-vaxxers. Quite frankly, I don't think that there are certain minds that won't change about certain things.
I know.
I'm talking about the 4 out of 10 people, approximately, that have some reservation around this. You're a mom, right? You're a nurse.
Yep.
What's your message to the vaccine hesitant?
So I always like to come at vaccine hesitant conversations with, I congratulate them for doing their research and being concerned with their own health and the health of their children and those they most love. And I'd like to meet them with that goal because I'm the same with my kids. So I think it's good to question things and to wonder what you're putting in their bodies and your own body. And I think that the thing about this vaccine is it's been super fast. And I think that just brings up even more questions. And I like to change the word as rush to prioritize. This world, has come together and prioritized this vaccine. And I trust that our system, our, government will actually make sure this vaccine is safe before they start giving it to humans in our public. And ultimately, it's already been given to thousands of people. And they have done a lot of studies looking at the implications, the side effects. And overall, vaccines are extremely safe. So from what I have heard from this vaccine so far, from all the physicians, from all my reading, this is one I would line up for. I would give my children. I would give it to my mother who's on maintenance chemotherapy, and I wouldn't hesitate. This virus is very infectious, as we know. It can impact you in all different ways. And even with mild illness, some people kind of shake it off, you can still have really prolonged effects that we don't know about. So the vaccine, I believe, is safer than the virus. And that's the important thing, is it's a risk-benefit conversation.
Jaclyn, there's been a lot of speculation, and I don't want to put you in an unfair position. I'll note that you're not an infectious diseases specialist or anything like that, but you are a public health nurse. You've lived this firsthand. People wonder about antibodies or immunity. Once you've beat COVID-19, once you've survived COVID-19, people wonder, can you get it again? And we've seen some stories out of China in particular where people have said there are people that are getting COVID for a second time. What have you been told? What do you know about antibodies, and what's your perspective in that context?
So I am personally extremely interested in this discussion, as you can imagine. I have literally, for the 6 months of my life, been COVID reinfections, typing in, trying to Google whatever I can find. So I have had many conversations about antibodies and immune protection and how long it lasts, specifically because I'm working in ICU at Vancouver General Hospital, literally with the people that saved my life. So I am exposed. I am around COVID again. And I asked myself, why am I doing this? I'm supposed to be there. I know I'm doing the right thing. But from what we know about antibodies is, yes, I have antibodies. They're actually using my blood to validate the rapid care test, which is pretty amazing. But antibodies will wane. So the number of antibodies can get so low, they're almost immeasurable. And that's with any virus. So antibodies you hear a lot about because they're easy to measure. But there's a lot of other better protection called the B cell and T cell, which is your immune memory. And that's what I was interested in. So this long-term protection of COVID. And I'm in a study for B cells. I'm in a study on T cells, and they're showing that we still have that memory, which is beautiful. I'm followed by an immunology clinic at Rockefeller Center in New York. I have my blood in Paris. I have my blood with 3 immunologists here in BC. They're all studying it, and they're literally calling me every 2 weeks, telling me their discoveries. And I'm telling you, I feel that I do have some long-term protection. For how long, we don't know because it's so new, but I feel protected for sure. So
Jaclyn Robinson's our guest. I want to ask you more about that blood contribution you're making in just a second. First, quickly, I'm gonna break away for a second to recognize a couple of sponsors. This show would not be on the air without the support of the team at Westworld Computers. As I'm talking to Jaclyn here, I've got my iPad, brand new, that 13-inch screen, loving it, giving me the updated Twitter hashtag action at Real Talk RJ. I've got my MacBook Pro here in front of me. I'm keeping an eye on the YouTube comments, and then Sam's got the big iMac on his desk, and we're set to upgrade, by the way, coming up soon. We're both very excited about that. It's Daryl and his team looking out for us like they've looked out for their customers in Vancouver, in Calgary, in Edmonton, Western Canada for more than 40 years. Family owned, locally owned. So this holiday season, if maybe you're hooking somebody up with something pretty special on the tech front, why not consider the local business that's keeping your favorite talk show on the air every morning at Westworld Computers? We're also grateful, and Sam and I are confident when we enter our workspace here that our air is moving cleanly and freely. It's a purifier thanks to the team at Clean Air Club. We asked them to audit our space, and one of the big things they focused on, they said, yeah, there's commercial elements here to think about in big businesses and towers like this. They said, but what about your home as well? People don't think as much about their furnace filters as they should, and that's where Clean Air Club comes in at cleanairclub.ca. You simply sign up. You tell them the size of the filter you need, and here's the thing. They drop them off at your door. They get you up to speed on the frequency replacement, what that needs to look like, and they support local with a special locally sourced gift for every one of their customers as they drop off your furnace filters. So check out cleanairclub.ca. You can link to them under the sponsors tab at ryanjesperson.com. Jaclyn Robinson is our guest. She's a public health nurse in Vancouver, and she is a COVID-19 survivor. You talked about they're using you kind of just said it in passing, and then we moved on, and I'm going, wait a second. When it comes to antibodies and research, what are they using your blood for?
So many things. So my first sample, they're biobanking my blood to actually validate tests. So I have a robust number of antibodies. So they're using that to make sure those rapid tests that you hear are actually giving good, accurate results. I've also donated plasma, and I've been going in every 3 weeks to actually create, a treatment for actual people who have COVID. And then recently I've been donating my B cells, and that's a really exciting adventure because they're actually making a pharmacological treatment for COVID with B cells, and it's doing amazing so far. So they're using my B cells to help with the treatment, and my plasma that has a therapy. And I went to the COVID units yesterday, and they're like, well, this new remdesivir, the steroids are really helping people be on oxygen for less time, and we're using the convalescent plasma. I'm like, yay. I'm just like, if I could give back in some way to reduce the suffering of someone else. Like, Ryan, you have no idea how COVID is impacting our healthcare system internally. It is so hard. So
well, you're right. Let me tell you,
bring any light.
You're 100% right that I have no idea. And of the tens of thousands of people that ultimately will watch and listen to this interview between now live and later this evening, Jaclyn, the majority of us, 95% of us, have no idea how it's impacting our healthcare system. Can you take us behind the doors? I mean, can you in layperson's language help us understand the impact that it's having?
Oh, so healthcare workers are exhausted. We haven't had a break. It never stopped for us. And it is scary. We're seeing people die, and they are dying often with these phone calls, holding phones up to their ears. We have, compassionate visitation now for end of life, but still it can happen quite quickly where people are passing by themselves. There is young people passing as well as older. So my friend's in internal medicine, and she just emailed me a couple days ago, and she's like, Jackie, people don't get it. She's like, I'm exhausted. Nurses and doctors some of them are wanting to quit. I'm rehabbing a 40-year-old that can't walk after COVID. She's like, the people don't get it. And I'm like, oh, and I see, Ryan, the masks that COVID, units wear are not the cute little medical masks. They're these enormous elastomeric filtration masks that are hot, they're heavy, they push into your skin, you hardly can talk, and you're in constant PPE. You're dealing with these patients that are completely isolated. So the unit is on shutdown. Same with long-term care. If there's an outbreak, there are no visits. And so these people are completely alone. You're overworked. You're trying to provide this compassion to them. You're scared. But I'm just inspired by the staff I get to work with. They are absolutely incredible, resilient. They're in this together. People are showing up every day on these front lines, whether it be a paramedic, emergency doctors, nurses, porters, the whole system, respiratory therapists, saving our lives. And that's honestly what keeps me, practicing these public health measures, is I've seen the eyes of them, and they're tired, and they're doing it because they know they want to do it and they care about all of us, but we need to care about them. And I'm there now working with them.
And I agree with you, and that's why I think it's and we've sort of stopped it. We used to Zoom with my uncle Lawrence, who lives in Vancouver, and we would Zoom with him every afternoon, and he would show us off his balcony, his beautiful view in Vancouver, everybody banging pots and pans and honking horns, and it was, as you know, Jaclyn, it was timed with the shift change, so healthcare workers coming in or out of the hospital could hear the city thanking them. And we started doing it in Edmonton for a while. My son and I walked around and banged pots and pans in our backyard for a while, and people had signs up thanking healthcare workers, and they were putting lawn signs up as though it was an election time to thank those healthcare workers. And over the months, I suppose that people's expressions have become exhausted as well. But ironically, the stresses and pressures on healthcare workers have increased. And I wonder if small shows of support, like, as you know, Jaclyn, yesterday, the province of Alberta finally announced a mask mandate, and we're essentially we're locking down for 4 weeks as of this weekend. That, to me, sends a very clear message to healthcare workers that are not only experiencing the stresses as you outlined, but let's not forget as well, the doctors and nurses and administrators and cleaning staff and everybody else, the maintenance folks in those hospitals, when they come home to their families, they're also not running up and hugging their kids, right? Let's talk about the fact that they're not able to emotionally recharge like normal otherwise.
Exactly. Some of these dedicated nurses and doctors who work in the COVID units I have friends who are nurses who have lost most of their hair because they have to scrub their hair so much to going in and out of these units. And I have doctors who I know who've actually decided to be isolated from their family because they put themselves at risk every day and too much exposure. And so people are making significant sacrifices to be in the hospital and to care for us. So I see it every single day, and I wish the public could sort of see it from that perspective. I don't want people to hear the messages then they're tired, they're burnt out, and they won't be able to care for you. But they are exhausted. That's the differences in March. March was fear. People were going crazy for toilet paper, and it was kind of like this mad rush. And, even when I was in the hospital, it was so much fear of what I had. Now we know a lot more. And now COVID patients are doing better. And we have more therapies. Doctors are more informed. There's just a huge difference now with compared to when I was admitted. But it's never stopped for us. And we're tired. And so we all want to get through this. Absolutely. So this vaccine is just awesome.
Jaclyn, before we go, and we can see there, our next guest is getting set to go here. We'll be talking to Tristin Hopper of the National Post momentarily. Jaclyn Robinson, our guest.
Behind the curtain here.
Little peek behind the curtain. That's what we're all about. We keep it real here on Real Talk. Jaclyn,
I love it.
This is, I know, and quite frankly, you and I could talk for another 90 minutes, or maybe we'll just bring you back some other day at some other time. We can do whatever we want, and it's very liberating. Jaclyn, and perhaps we'll check in with you again in a number of months and see how you're doing. But here's how I want to wrap this interview, and I saved this till the very end because this is so exciting, and I want to congratulate you in person. I wish I was looking into your face, but we'll do it by way of camera. You are about to ramp up your own personal journey on the education front as well. You start next month your master's in health leadership and policy at the UBC Sauder School of Business. Was this something that was on your radar before, or has your COVID experience literally put you onto an entirely new path?
Totally new path. I mean, I call this the most forced pause in my life, where it was like I took away my voice, and then my voice was taken away, my strength, everything. And you do a full inventory of your life. You figure out, who do I want to be? What matters to me? And I thought, I have 20 years left in my career. And this program planning with all the COVID work I've been doing was just energizing me. So I sought a master's program, and this one combines health sciences with business. And it's everything that sort of I want to do with that organizational leadership. So I'm super excited. I start in January. You know, my family's a little fearful, but I'm like, Mama's going back to school. So see how that goes.
Well, I'm so excited to see what the doors that will open for you. And obviously, I think it's very obvious to people, and they're saying it. You can read the YouTube thread later, the comments, if you like, Jaclyn. But people are so impressed by your message, and obviously what you're doing is so incredibly important on a number of fronts. So I wish you well with that. I can't wait to see what you do with it. My love to you and your husband, Kirk, a great friend of mine, your family as well through this holiday season. And thank you for making time for us today.
Thank you. And congratulations, you, sir. I am just loving this show. We are listening to it nonstop. You are so good at what you do, and I couldn't be happier for you. This is just perfect venue for you, and it's just an honor to be on your show. So thank you for having me.
Thanks, Jaclyn. You're welcome anytime. That's Jaclyn Robinson. As you can tell, a very good friend of mine. I've known her for 25 years. She's a COVID survivor, not using the word lightly. She survived it out of a medically induced coma, was wheeled out of the hospital by her husband in a chair, could barely walk to the end of the block. Weeks and weeks after this happened. I'm not sure if her Instagram is locked down. It may be a private account, but there's a photo that she posted in April, late April, of her and her daughters on a beach, on one of Vancouver's beaches, and just the fact, it was monumental that she had even been able to get out to the beach with her kids, that she'd been able to walk from the car to the sand, or however they got there. It was like things that we take for granted. Right? These are the perspective checks that we want to have here on the show. We're going to get to Tristin Hopper in just a moment, of the National Post, one of my favorite people, quite frankly, to talk to. Wildly entertaining, very insightful, and quite frankly, he doesn't give a rip what you think about what he says, and those are the best kind of guests on Talk. But we're also, of course, focusing this morning on what we heard yesterday from Dr. Deena Hinshaw, Premier Jason Kenney, and Ministers Doug Schweitzer and Tyler Shandro, the Minister of Health. And yes, we are going to show you the Doug Schweitzer video, because I need to know what you think, whether or not he actually faked using hand sanitizer. That's kind of one of the things. It's not the most important thing to talk about today, certainly, but it does send a real message. We're going to show you that video. We'll do some video review, and we'll see what you think about that. But before we get to Hopper, because I want to ask him about Alberta's measures introduced yesterday, why don't we take a look? Why don't we take a listen? If you're tuning in live streaming audio on Mixlr, let's listen to what Alberta's Chief Medical Officer of Health, Dr. Deena Hinshaw, had to say. This is a perspective check, if ever there was one. Here's Dr. Hinshaw yesterday afternoon.
Since the first case was confirmed on March 5th, more than 72,000 Albertans have been diagnosed with this virus. This includes more than 20,000 who are actively infected at this moment. If you gathered everyone who has been diagnosed with COVID-19 together, it would be the 5th largest city in Alberta. 1 in 3 people have now been tested at least once, and we are approaching 2.4 million tests done. 2 months ago, on October 8th, our positivity rate was just 1.34%. and we had just 184 new cases across the province. Today, our positivity rate is 9.41%, and our 7-day average of new cases is 1,785. There have been outbreaks in almost every type of group setting: parties, family dinners, sports cohorts, long-term care facilities, schools, hospitals, workplaces, and supportive living facilities, just to name some examples. We have seen the virus touch every region and every age group. Our youngest reported case was less than 1 year old, and our oldest was 108. Many of those who've recovered have faced lingering side effects and serious outcomes. Most tragic of all are the 640 lives that have now been lost to this virus. Every case is a person, and every hospital or ICU admission is a patient who needed care. We are all at risk of COVID-19. We are all impacted by the toll it is taking on our health system.
That was Dr. Dina Hinshaw speaking yesterday to Albertans. Okay, so Sam was just letting me know behind the scenes. Sam Brooks just does an amazing job here as senior producer of the show, which involves keeping the technical things going, helping with the editorial duties, making sure Sam does basically everything around here, and the entire show would be totally screwed without Sam. Have I painted a clear picture of what Sam Brooks contributes to the show? So we're waiting on Tristin Hopper, who's gonna.
We're waiting. He's popping in right now.
Okay, he's popping in now.
I should have him ready in like 2 minutes.
Okay, that's fine. Would you like some more time yourself, or would you like to talk to me, or would that stress you out? Because I'm curious to know. Are you able to load up the Doug Schweitzer video for us? This is something
Absolutely,
that if you're gonna at me, if you're gonna sort of troll me here and say, Jesperson, this is certainly far from the most important thing that was covered yesterday, you would be absolutely correct, which is why we have buried it, right? Which is why now 65 minutes into the broadcast, I'd like to show you this video. It is not the most important thing that happened yesterday, and in fact, it may not actually even be accurate, the allegations that people are making. But what I want you to pay close attention to here is when Minister Doug Schweitzer, I believe I incorrectly identified him as Alberta's Justice Minister. He's been moved out of that portfolio. But Doug Schweitzer, the MLA, the minister out of Calgary Elbow, you remember he beat Greg Clark in that nail-biter last election. He approaches the podium to speak yesterday, shortly after, I think it's Minister Shandro that went ahead of him, right? Minister Tyler Shandro pumps the hand sanitizer. And let's be honest, let's keep it real here. Everyone's going to go, oh, this isn't how real people are acting. Like pump, sanitize, mask on, pump, sanitize, mask off. That's what we're supposed to do. And it's important for these officials that are delivering public health measures and announcements to be modeling the behavior for people, right? So that's why they're doing it. And maybe they're rolling their eyes, and maybe you're watching, and maybe you're rolling your eyes, and whatever. Maybe that's the reality of it. But the fact of the matter is, behavior modeling matters, right? I mean, it's why we even have little things like hand sanitizer on our desks. It's why we're wearing masks in the hallways here. It's why we have the purification units going.
I
why
literally
we're keeping
keep
our
a bottle
distances.
of it in my pocket at all times.
Sam, I get a little actually worried about, you're one of my friends I worry about. Do you have aloe in your sanitizer? Because I notice you sanitize a lot. Are you worried about the health of your skin?
I've used so many different brands of sanitizer that I'm getting to the point where sometimes I don't even know what's in it. I know some work better than others, some feel a lot better than others. I've been using way more moisturizer than I've ever done in my life before.
Yeah. Let me by the way, keep yourself on camera. I want to try something out with these sexy new lights that we've got. Oh, there we go. I shut them right off. You were coming across a little hot. I wanted to see if,
yeah,
you're hot there. I mean, you're always hot, Sam. What? But in this circumstance, okay, there we go. Look at this. I can control our lights with a remote control. The lights continue to get better and better here. We're having some fun here in the midst of serious circumstance. Can you give me that Schweitzer video? Here he is. Here's what all the hullabaloo is about. Tell me, so Shandro pumps the sanitizer pump on the one side of the podium. Now, that's not to say there might be, maybe there's something else. Maybe there's like a wet pad down there with sanitizer on it or something. I don't know. I don't have a view. But just let me know what you think. Does Minister Doug Schweitzer actually fake sanitizing his hands? Let's take a look. So there goes Shandro. Okay, watch this.
Thank Thank you, Mr. Shandu. And
Okay. Can we just for those in the back that weren't paying attention? If you were on your phone, if your kids are like, "Mom, where's my pancake? Dad, where's my favorite toque?" Okay, come on, get to your screen right now. Can you load it up for me one more time? Let's take a quick look again, just one more time, just to be fair here. Okay, here's Minister of Jobs, Economy, and Innovation, Doug Schweitzer. So there's the Health Minister, Tyler Shandro. Pump, full sanitize, picks up his mask, puts it on. Bang up job, Mr. Health Minister. Nails it. Watch this. Here it goes. Yeah.
thank you, Mr. Shandu. And
come on. And the sanitizer's just I don't know. Maybe there was a wet pad there with sanitizer on it. Maybe there's some. I don't think so.
Well, and he's been saying he used a bottle off camera. So why did he rub his hands
So why
as soon as he
fake
put
it?
as soon as he put his papers down?
Yeah. So you used a bottle off camera, but then you faked. It just
Anybody also knows because we've all become so accustomed to using hand sanitizer now. Anybody also knows that it's gooey and it's runny and some of it's more liquid than others. And you can't walk with a fistful of papers in your hand and also have sanitizer in your hands. It would just spill all over the floor, right?
Yeah. Jesse is watching the show this morning and using the hashtag RealTalkRJ. He says, hey, at least his washing technique is decent. Yeah, I mean, it is. It is. But I think 10 out of 10 public health professionals will tell you that sanitizing your hands without sanitizer doesn't work. I with confidence. I mean, 4 out of 5 dentists may agree that brushing your teeth will keep your teeth clean, but 5 out of 5 immunologists and virologists will tell you that sanitizing without sanitizer is ineffective. As we say hello to one of my favorite all-time dance partners with a Christmas tree in back, coming to us live. Let's get him centered here. There we are. See, if we get you centered behind the tree, it's going to look like a big hat. Tristin, can we get Tristin centered? Is that more on his end than ours? Yeah, there you go.
It's a little more on his end than ours. Yeah, there we go.
You see, Sam, you said that in a very non-judgmental way. You go, it's a little more on his end than ours. Yeah, there you go. Tristin, welcome to Real Talk. What a thrill to have you making.
Can you hear me? Yeah. I hope you can hear me.
I can hear you okay. What are these headphones?
Oh, great. Okay, a lot of audio problems on this end.
No,
I've been a hermit for several weeks. I haven't been speaking to anybody. That doesn't. That's not a hallucination. So it's I've had no need to get the Zoom on board.
Well,
it's good.
It kind of feels these days like we just expect everybody to be good at Zoom, right? I mean, it's like I didn't even know what Zoom was last March, but now we just say to everybody, it's a verb now. We say to our guests, could you zoom in for 9:35? And here you are. These headphones you're wearing, are those
should be good at Zoom, considering it's like one click. I mean, if you're not good at that, there's something wrong with you.
You're coming to us live from. Well, there are things wrong with both of us, but they're probably not relevant to the conversation we're about to have. It's great to have you back on the show. People are going to be saying, I want to address if it's an elephant in the room. It might be a baby elephant in the room. But people are going to be saying, Tristin Hopper, I thought he left the National Post to go work for this independent media startup in Victoria. Why is Ryan introducing him as Tristin Hopper from the National Post? I understand there may be limitations to what we can discuss here, but you're back at the Post.
Sure. First of all, kudos to those listeners who would have that much background information. I think that's super fan level to actually know that about me. But I have been fired from Capital Daily, and I met with a very expensive lawyer, and that lawyer has told me to say that. Okay, I just got my notes here.
Okay, good.
These aren't notes. I'm just reading my hands, just like Doug Schweitzer. It's not real paper. Okay.
Okay.
Anyway, that lawyer told me to say they have moved in a different direction, and that direction no longer involves me. So I'm back to the National Post, where they welcomed me back. I think they see it as sort of a Romspringa. This is the event where Amish children are allowed to go experience the sins of the world, and then they realize that they never should have left the faith in the first place, and then they are more faithful than ever before. So that's pretty much describes my return to the National Post. I think I belong there more, and I'm very much looking forward to return. So I haven't told anybody. I still haven't inked the contract, so they could still decide they don't want me. The plan is for me to return mid-January.
So in other words, I may have just put you in a very awkward position without knowing it.
Well, no more awkward than the variety of awkward positions I've occupied in the last few weeks. Okay. I think it's fine.
Okay, that's good. It sounds to me like your list of what your lawyer has told you can talk about with regards to your former employment situation is very similar to the list that my lawyer has provided with regards to my former employment situation. I was talking to former AM 640 talk host Supriya Dwivedi on Friday, who resigned from her position. And I reached out to my lawyer ahead of that conversation, and I said, hey, what can I talk about with regards to my situation? And he said, it's pretty simple. Nothing. And I said, okay.
Oh, nothing.
So
I think I had a bit more of a creative lawyer. I was trying to describe, what I wanted to say. Like, can I say this? And he's like, no, you absolutely can't say that. Can I say this? No, you absolutely can't say that.
Yeah.
Can I say this? I guess you could sort of say that if you wanted. So, employment law is sort of, I imagine it's pretty boring. It's just like, executive of like an auto parts chain is trying to, get larger severance. So,
yeah.
My conversation where I just wanted to find out what I was able to say, I think that was kind of a creative, I think we had a fun time together.
Yeah.
Maybe not worth $350, but it was okay.
Okay, yeah. I think a smart person in our situation always wants to keep the NDA in play with regards to what can be negotiated. Ultimately, as I look back on this, I can't help but wonder if this might all spawn a book at some point. And so the NDA, I think, could come into play there. So I'm listening to everything that my legal counsel has to offer. Let's get serious. Let's get down to this for a second, because there's a million things I want to talk to you about, Tristin. But starting with, you're watching Alberta right now, your former province of residence, from your current province of residence. And even then, you're somewhat sequestered with hundreds of thousands of other lovely people on one of Canada's most beautiful pieces of real estate, Vancouver Island. Victoria has certainly not been immune from COVID, but the numbers are not like they are in Alberta right now. What do you make of what you saw from the Alberta government yesterday, and do you think the measures are appropriate? Some people are saying they're bang on. Some are saying it's going to hurt business irreparably, and they may be right. And some are saying this should have been done 3 months ago. What do you think?
All those people could be correct. I don't think anybody is denying that it's going to hurt business. So, that's what's so difficult about these lockdowns, of course, is you can't be doing single factor analysis of just like, oh, we brought down the COVID rate, but the suicide rate and the domestic abuse rate, and there's no more economy left. So that's the way not to do it. I'm more inclined to trust the Alberta government and the BC government as well, more than almost anyone else in North America who's been putting in these measures, because I think one of the biggest problems we've seen, particularly in the United States, is measures that don't make any sense, and then you lose public trust with that, or measures that don't really take into account the side effects of these types of lockdowns. So one of the great examples is California banned outdoor dining. It's still warm in California. You can still eat outdoors. There's zero evidence whatsoever that outdoor dining leads to new cases, but they just banned it because we can. So based on what the rhetoric you've seen from Alberta, which is very much taken into account, I think they've taken into account the negative effects and the side effects that these types of things have. Yeah, when BC puts in measures, when Alberta puts in measures, there's been very few just dumb COVID restrictions in both of our provinces. So I think if you did polls, you would find a higher level of public trust. Like a good example of a Canadian screw up on COVID measures was Manitoba. They put in some measure. It was like you could only buy essential things at the grocery store or the Canadian Tire. So you go to the Canadian Tire and a scarf was essential, but a toque wasn't. So the toques would be roped off, and it's like, you can't buy a toque, but you can buy a scarf. So you see a few of those and you're like, oh, screw it. I'm just going to go to dinner with grandma. I don't need to listen to the government. So yeah, based on how Alberta has acted so far and, the way it's sort of treated this scenario, if I was living under the just very, very, very strict restrictions that you're under, and that's no good for anyone. The prospect of not having a Christmas, I think I'd be more inclined to trust Jason Kenney than, California's Gavin Newsom.
Does Jason Kenney deserve the public trust right now. He bristled. Did you see this exchange, Tristin, with the reporter, with Sammy Hoods of Post Media? Do you know Sammy, by the way, personally?
No, and I try to know all people named Sammy. So this is a
right?
is a failure.
And actually, the premier calls him. I mean, his name is Sammy, so obviously he calls him. But the premier calls him by name. You have to see this exchange. Sam. Okay. So here's the deal. First of all, on Twitter, this is amazing. A tweet that's coming in from a listener that's tuned in that basically says, if you're going to fake, this is incredible. If you're going to fake hand sanitizer, this is Sarah that sends this tweet in. She says, if you're going to fake it, you've got to fake it better. Like I'm talking when Harry met Sally faking it. Which is potentially one of the tweets of the day, Sarah. So thank you for listening to the show. We appreciate that. Okay, Tristin, this clip's going to take a second. Now, I'm not going to play the full one because it goes for 5 minutes. When's the last time that an elected official has answered a question for 5 minutes? But you can tell that Premier Jason Kenney is pissed when Sammy
Peter
Hoods
McKay actually runs out of batteries after 4 minutes. So
yeah, that's right. That's right.
Can't.
Yeah, either batteries or content. But so Sammy Hoods asked the question. We're going to include the question because it's relevant. And Premier is, you can see the steam coming out of his ears and watch his body language and how he answers. And again, we're clipping it because I'm not going to subject you to the full 5 minutes, but it's telling. I mean, he takes it on like, anyway, it'll speak for itself. Sam, let's roll it.
Hi, Premier Kenney. Approximately 1 month ago, you said that COVID fatalities represent, and I quote, a tiny proportion of deaths in our province. Since that day, around 300 more Albertans have died due to COVID-19. Hospitalizations, as you've noted, have risen from around 170 to well over 600. ICU admissions from 30 to over 100. We're the last province to implement the mask mandate, and you've resisted calls from health experts for months to enact the very measures that you've announced today, including saying that Alberta is doing the bare minimum a few weeks ago to help keep the economy running. So from a health perspective, it's clear that your approach hasn't worked to date and has arguably even cost people their lives. Do you acknowledge any responsibility and apologize for the way you've handled the second wave of the pandemic?
That sounds a lot more like an NDP speech than a media question, Sammy. I reject the entire premise of your question. First of all, we do lose about 26,000 people to deaths every year in Alberta. And what I said at that time is absolutely accurate. My point was to put that in context, and we've tried to keep everything in a balanced context throughout. In terms of masks, this was the first government in Canada to recommend mask usage when the Public Health Agency of Canada, the World Health Organization, and many media outlets, perhaps your own, were parodying the advice not to use masks. Alberta was calling for masks. I'll remind you as well that when the federal government was responding to pressure from the World Health Organization to keep borders open from COVID hotspots, I was calling for them as a former immigration minister to be closed, as the East Asian jurisdictions did so effectively to limit spread and have the best COVID outcomes in the world. This is the only provincial government to have provided a widespread free mask program, providing tens of millions of free masks to Albertans to normalize their usage fairly early in the pandemic period. We believe that, as I quoted 2 weeks ago from former Prime Minister Sir Wilfrid Laurier, that often the sunny ways of persuasion are more effective than the harsh means of coercion.
So there you have it. Alberta's Premier quoting Sir Wilfrid Laurier. I
do like how you characterized him. You did, if we check the tape, you said steam was coming out of his ears, which, maybe it's just because I'm in raving hippie town. But that is a very calm level of steam. I think that's me. Just Alberta. That's Alberta angry. Where he's just, well, Sammy, I reject all premises.
Well,
he definitely did. He's angry, but
there are different versions of Alberta angry.
Yes,
Alberta
I've seen both sides.
Alberta angry can be truck convoys to Ottawa parked in front of Parliament, and Alberta angry can also be that, which is when Jason.
The quiet angry is way scarier.
Way
quiet
scarier.
Angry. That's the guy that burns your house down.
Yeah, 100%. That's way scarier. But he's super upset. He says that sounds like more like an NDP speech than a media question. The Canadian Association of Journalists, by way of their official verified Twitter account, pushed back on that yesterday, by the way. Was the Premier out of line in invoking a partisan reference there, or is that fair ball, considering that Sammy threw a fastball right at him?
I don't like questions where you're asking a politician, like, do you feel bad, or obviously, do you have some regret? Because, I mean, you're never going to get an answer where, like, actually, I do feel regret. I've made a big mistake. Thanks for bringing that up.
Why not, though, Tristin?
So you're never going to get a satisfying question. But I don't know. I would probably, if I was Sammy, I'd be pissed off that I was accused of being partisan. And I don't think it was an openly partisan question. But I also sympathize for both sides on this, because there is no roadmap to avoid it. So like at the beginning, you had Sweden, which was sort of keeping their economy open. They were experimenting with, maybe we can, avoid all the job losses and all that nonsense, and then just fight COVID in our own way. That hasn't worked. And now Sweden, once the model of how to address COVID, they're having to put similar lockdown type measures in. I don't know. I mean, there have been a lot of recommendations from public health officials that turned out to be really stupid, and it was good to ignore them. So nobody knows how this thing is going to play out. For example, the one I constantly bring up is that, remember in April when they were telling us masks don't work, and they were actively discouraging people from wearing masks? Mm-hmm. And then, of course, that's shifted 180 degrees. Way back at that time, the science was very clear. I mean, if you read any of the literature, that precautionary principle, you should be wearing masks. So it was really strange that public health officials across the board were not recommending masks. So I'm not as persuaded by the public health official said this, so thus you should have followed it to a T, and anything that goes wrong is your fault. Because there are still so many unknowns, and I don't really hold it against any government that is trying to maybe more aggressively balance the economy side with the health side. So I think Jason Kenney is caught in a situation where they tried something, it didn't work, lots more people are dead, and he's going to be testy. Yeah.
Testy for sure. We saw this morning, Tristin, just about an hour ago, Health Canada has approved the Pfizer vaccine. This is the Pfizer BioNTech vaccine that'll be available to Canadians, about 250,000 doses by the end of this year, and then, of course, more in the spring. What's your personal take? I don't think I've ever talked to you about vaccines before. Will you be getting the vaccine? How do you feel about it?
Oh, yeah. I'll put anything. Maybe I'm not the best example for Mr. Pro vaccine, because I will put anything in my body. I'll eat cold hot dogs, that I found. And, it seems to work out well. But, I think I very much trust the vaccine approval process. And, if this is something that is going to restore us to some sense of normalcy, and then, stop everybody from going nuts and sort of, bring this to an end. So of course I'm going to get the vaccine.
What do you,
I love,
well, I was talking to a couple of guests. I love vaccines, he says. I love, this is a total aside, just on the bumper sticker movement about I love whatever. I've always got like, I love New York. I love Alberta beef. And then I understand the messaging, but I've always kind of laughed, like, not that I don't feel the same way, I guess, but like, I love Canadian oil and gas. And it's like, I mean, we love it because it provides jobs, and but you love oil. Like, I mean, I love
seeing that bumper sticker in Victoria, because, you're putting yourself on, you're really pissing people off there. You're getting honks.
Yeah, you are.
There are a few of them. There's like 2 or 3, and I see them all the time.
Yeah.
And I respect it.
So it's, it can be like, I support vaccines. I believe in vaccines. I love vaccines. Might be an interesting one to push out that bumper sticker. But I've been asking.
Put that on my car.
You'd put that on your car.
I would put an I love vaccines bumper sticker in my car. 100%.
Okay. We'll see if we can get you one. Maybe we could brand it with the show's brand, and then, but Tristin, what do you make of, I asked Dr. Sajjad Fazel about this earlier this show, there's been some suggestion that, for example, kids that aren't vaccinated should not be allowed back into public schools. The idea people are floating, for example, what about these big metal tubes? What about airplanes? If you're not vaccinated, would an airline ever prohibit you from flying? What would you make of something like that on first glance? Is that something you can see, A, even being reasonably implemented and enforced, or B, something that's appropriate, or is that a little too personal? Where do you stand on it?
Well, you also have you do have the issue of there may be people who can't take the vaccine. So this is something that always came up with
right.
Like measles or something. There are a few people that aren't able to take the vaccine, but I don't really see an issue with that. I mean, even if we're speaking to a libertarian here, the libertarian would say, well, you can ban anybody you want from your private business. So if you're an airline and you decide the only way you can operate with packed cabins and not have the liability of an outbreak, which of course is devastating, is you have to have vaccinated people, I don't really see a problem with mandating that. So I think, generally, I'm more inclined to go the route of let individuals and let businesses make the decision that makes sense for them. Because I think one thing we've seen throughout this pandemic is that most of the time people will make the right decisions. I mean, you always see on the media, there's the anti-masker, the person coughing. We always highlight the idiots, the COVID-idiots. But I think what I've learned from this is that the vast majority of people are quite smart. They will listen to the data and they will do what's right. A great example actually is one of the reasons that BC's getting hit hard now, but it was very much dodged the early days of the pandemic. One of the going theories as to why that is because Richmond, heavy Chinese Canadian community, when China, when China is saying, don't worry about it. This is January of 2020 when China is saying, don't worry about it. We got it all under control. Not a pandemic. It's okay. Richmond, Chinese Canadians said, oh yeah, don't listen to Beijing. Screw them. We're wearing masks. We're sanitizing. We're social distancing. As early as January, if you went to Richmond, it looked like the rest of the world does now. There's very good reason to believe that because they did it, ignoring all the public health officials, ignoring the WHO, ignoring China, they saved the rest of BC. They stopped it from getting a handhold and then basically denying BC the first wave. So I think that's been true of a lot of communities. Mandates aside, businesses and people will make decisions that will keep them safe.
Tristin Hopper's our guest. Tristin, I'm going to fit in a quick break, get to some of the headlines, and then we'll be back. Tristin's been taking on kind of a cool mission, and I know it'll benefit all of us, taking a look at some of the news stories that have been buried as a result of COVID-19. I mean, even look at our headlines to look introspectively here. Most of what we're updating you on is COVID-related for obvious reasons. But that means that other stories are maybe not getting the attention that they deserve, and there's a couple that Tristin's following that we want to get to. First, we want to thank the team at Local Waste for their ongoing support of this program. We wouldn't be on air without Chris, Labossiere, Lauren, and their team's support. Of course, Trash Talk comes up every Friday around 10 o'clock, and we want your submissions. Just simply email talk@ryanjesperson.com if there's something you got to get off your chest. Trash Talk, one of our favorite 4 minutes of the week, around 10 o'clock on Friday mornings. Local Waste has been in the business of waste and recycling management for more than a quarter century, 25 years, going up against the big internationals, the faceless garbage companies. They're locally owned, locally operated, and they're expanding locally as well, with potentially an opportunity for you. If this has piqued your interest, go ahead and check out the sponsors tab at ryanjesperson.com for the link to their website, or just go directly to localwaste.ca, and they'll take your call directly as well at 780-242-9746. And what can we say about the team at Dairy Queen in Northwest Edmonton and Sherwood Park? 6 locations there: Palisades, Nemeo, Newcastle, Westmount, Y Gardens, and Baseline Road. They're like everybody else going to be impacted by these new measures, but their drive-thrus and the delivery apps remain operational. So why not treat the family to Dairy Queen tonight? And keep in mind that at these 6 locations only, because of the Real Talk partnership only, Christmas ice cream logs, these frozen Christmas ice cream logs, the famous ones, the ones you enjoyed as a kid, and now as I'm talking about them, you're remembering them, and now it's all you can think of 10 seconds later. They're 50% off only at the Dairy Queens in Northwest Edmonton and Sherwood Park. Let's take a quick look at the headlines before we get back to Tristin Hopper with the National Post. Of course, we're talking about new measures introduced by the Alberta government yesterday, and, well, it's going to impact you no matter what your situation is, because as of this weekend, for the next 4 weeks, entertainment businesses and entities are demanded to close. Casinos, bingo halls, gaming centers, race centers, horse tracks, raceways, bowling alleys, pool halls. I mean, use your imagination. Legions, private clubs, doesn't matter. Still closed. Art galleries, libraries, museums, cancel your plans. Closed. Amusement and water parks, obviously closed. Indoor playgrounds, theaters, concert halls, banquet halls, trade shows, closed. Indoor and outdoor gatherings with people outside your home unit, against the law for the next 4 weeks. And employees that can are expected to work from home unless your employer says they need you on site. You can check out alberta.ca for more on that. I want to give a shout out to Kurt in Mill Woods, who in real time has put a story on our radar that we're putting here into the news. The UK regulator, health regulator, British medicines regulator is warning people with significant allergies to think twice about the current COVID-19 vaccine from Pfizer and BioNTech. 2 people who had the shot Tuesday experienced allergic reactions. They're National Health Service members, NHS members, so it caught the NHS attention immediately. They experienced anaphylactic reactions after receiving that Pfizer vaccine on the first day of the campaign. Both reported to be recovering well. Both of them had a history of severe allergic reactions per the NHS news release. And on the investment front, do you hold Canopy Growth stock? Did you hope to ride that green wave and invest in cannabis and see your fortune create itself? Well, Canopy Growth is one of the big ones here in Canada. They've just announced this morning they'll be closing 4 facilities and laying off about 220 staff. So more tough news on the investment front when it comes to cannabis. Let's get back to Tristin Hopper. Tristin Hopper, soon to be, although I feel like I shouldn't really be announcing this. Why don't I just call you a well-read and respected journalist, per your Twitter bio, one of Canada's most influential people? Does that work for you, Tristin? And the creator of Canada's largest Rice Krispie Square. People can see the photo on your Twitter homepage.
That's right. Nobody has challenged me for that honor. So you gotta pick something that's so ridiculous no one would bother, taking the title from you.
It's like people that are Guinness World Record holders in whatever. I mean, you just hold it until somebody else decides to do it. It's very doable. You just have to find something so obscure that no one else is going to challenge you on it. I'm surprised that through COVID, we've had nothing but time on our hands. People have had nothing to do. Some people are cleaning out their pantries, and there has to be at least one person that found a case of old Rice Krispies they're not going to eat. I'm surprised nobody challenged you. How many boxes of Rice Krispies did that thing take?
Well, I wasn't using Rice Krispies. Here's the secret. I was using the Loblaws brand.
Ooh.
It was like, crispy rice or something.
Yes.
And then I was using even off-brand marshmallows. I think instead of being made out of hooves, they're made out of, the other part of the skeleton. I'm not sure. But anyway, I think it was 11 boxes of 500 grams. I used to have this at my fingertips. It was a fair amount. I would say the price, though, it was about $150 to do that, and I fed the whole neighborhood. I was like the person from Myth who feeds a lot. I used to have the name. Sorry, I think it's right.
Okay, I encourage people to check out. Just go to follow Tristin on Twitter at Tristin Hopper, and he has it pinned to his profile. This Rice Krispie Square. It's absolutely incredible. You've been following stories that, and it's obvious. I mean, we're even guilty of it in our own newscasts because you can't really do a COVID update and then an entire other newscast, but that means that stories that would otherwise be either leading the headlines or at least seeing exposure simply are not. What are some of the more compelling stories you've been following that really haven't seen national attention like you think that maybe they should?
It just things that happened this year. So news stories, when you tell people like, this happened in 2020, and people are surprised to hear it. Remember when Iran shot down one of its own airliners by accident? That was in 2020. That was January 8th. But this was escalating tensions between the U.S. and Iran. They thought an airliner taking off from Tehran International Airport was an incoming missile or something. So they shot it down, killed 178 people. That was in 2020. Remember when the Pentagon basically confirmed that UFOs exist and released a bunch of videos saying, oh yeah, here's some phenomena, some weird, lights in the sky that we can't explain, and we're the US military. I guess UFOs exist. That happened this year. Canada's worst ever massacre. That's the really surprising one. I'm sure Nova Scotia listeners, have no problem remembering that, but we had the worst mass shooting in a year that actually had very few mass shootings. That's one of the upsides of COVID-19 is everyone's home, so you can't go out and shoot people. Canada had the worst massacre in its history, 24 people killed in the small town of Portapique, Nova Scotia, in the most terrifying circumstances possible. A man dressed as a police officer driving a fake cop car and basically gunning people down on their front doorsteps in this small town, basically the last place you would expect it. That happened this year. And then another space-related one. This was the year that NASA was finally able, you had your first private space contractors, Elon Musk, SpaceX, sending space capsules to the International Space Station. So this is the first time since the retirement of the space shuttle that there's been a non-Russian way to get to the ISS. So all these news stories, and then death after death, all the, lots of major celebrity deaths, not necessarily of COVID-19 that we've just sort of forgotten about because it's just been blown over by COVID-19. So yeah, you're right. There's been this whole other year of shadow news that we missed. It's just like after 9/11. A bunch of interesting stuff happened in the latter half of 2001 that we just forgot about.
Yeah, you mentioned Nova Scotia, and they had that stretch, the mass shooting, which was obviously devastating. That rocked the entire country. That Canadian Forces chopper went down off the coast of Greece. You remember with Nova Scotia servicemen and women aboard, and that 4-year-old boy. I can't remember his name. Maybe my mind is blocking it from my memory because I have a 5-year-old son, and I was absolutely devastated by that news. But you'll remember that little boy, under the care of his grandparents, went missing. He wandered off and was later found. And all of those incidents happened within, if I remember correctly, Tristin, I think 2 or 3 weeks within one another. And now
and then you had overlap. I think. There was a sailor who was she was in a viral video, I think playing some sort of musical tribute. I forget if it was bagpipes or trumpet.
Yeah.
In the wake of the massacre, and then she was killed in that helicopter crash. So just unbelievable tragedy to hit. And
let's
relatively
not
small place.
And
speaking of tragedies, we also had that snowbirds crash.
I was just going to say the snowbird crash, which to me was like. The snowbirds, as everybody know, and maybe we need to be reminded, though, maybe we shouldn't say as everybody knows because there's been so much going on and swirling around us, but the snowbirds were on their cross-Canada tour to instill hope and joy and renew people's courage and do what they do and have the impact that they have. And then to have a flight go down, have a plane go down was just like, it just sort of, and I don't mean this disrespectfully to I'm not dismissing it as this, but it was like the most 2020 thing that could happen. I mean, another example here in Edmonton, I think Canadians from coast to coast know who Joey Moss is, the legendary, one of Wayne Gretzky's best friends of all time, easily one of the most beloved Edmontonians of all time, a legend within the Edmonton football team and the Edmonton Oilers organization. Joey Moss passing away this year. Alex Trebek passing away this year. Didn't Mr. Rogers? Was Mr. Rogers this year, or I might be wrong on that, but it was just like cultural.
Oh, he's been dead forever.
Yeah, he's been dead for a long time. But Alex Trebek was another example where it was like cultural icon after cultural icon passing away. It's just been a year from hell. And I know that we always say that we go out 20.
Now there also is a fixation on bad news. So some good things happened this year.
Yeah. Okay.
None of which come to mind. There's been non-COVID medical breakthroughs. We've made, the sciences have actually done great because you have all these scientists sitting at home. So they're like, I'm going to discover a species or cure some disease or something. So there's been a lot of breakthroughs in the sciences that, of course, got missed. And I think there is a tendency to sort of fixate on the bad news, to say, oh, of course, that would happen. It's like when you're having a bad day and then you just start tallying up, of course I would hit a red light on this day of all days. So good things have happened. And as I always remind people, We've had way worse years within living memory. So this hasn't been a great year. But in terms of just bad years to live through in, human context, looking over the past 100 years, I'd rather have 2020 than, 1967, 1942, 1930. Things are bad, but things are relatively good, all things considered.
Yeah, I mean, I think anything from 0 AD up until about the 1600s was also probably pretty lousy as well.
Yeah, there's a game I play with my grandma. My grandma's 99, and then she'll, I think we should have a class action lawsuit against CNN because she just watches CNN. And then, it's like, oh, the world's going to hell. And then I pull out a map where she grew up in Alberta. And I say, well, here's the Indian residential school. Here's the Japanese Canadian internment camp. Here's the polio hospital. All these things that you just didn't have the 24-hour news cycle that you were not aware of. All of those things don't exist. So, part of it is just we have more exposure to news. This is a news program. You should continue consuming it as much as you humanly possibly can. But, there is a difference in how we're exposed to news versus how we used to be.
My understanding is that you're embarking on you have embarked on a project with your grandmother, who I know you're very tight with, 99 years of age. Amazing. Maybe a little bit similar. And I wish I could go back and do it again with better equipment and more experience in storytelling. But I'll be forever grateful that while my 4 grandparents were still living, and they've all passed now, but while they were all still living, I undertook an assignment while I was a student at SAIT Polytechnic in Calgary to mic them all up, to set up cameras and lights, and to interview them, and to have them tell their stories. And I have it on a DVD, and it's something that I'll cherish for the rest of my life, to hear their voices and have them recount their childhood stories. You've been undertaking somewhat of a similar exercise through the pandemic with Grandma Hopper. Can you tell us about it and some of the things you've learned about her that you didn't know?
Getting fired. So I have all this, unemployment time. So I thought, okay, well, I have microphones. I'll set it up. I've been wanting to do it for a while because one of the things is, as you know, as an interviewer, I bet when you did that, when you're re-listening to this audio, you're embarrassed because you probably didn't have the interviewing skills you have now. So I did the same thing when my grandma was 90. I tried to do an oral history interview, and I actually sucked at it because I was just asking, when the war started, were you sad about the war? And you just get kind of these defensive and surprised questions. I found this time around, I'm just doing the very small details so if you're talking to your grandparents, that's the details you're going to want to remember because everybody knows when the war started. Everybody knows what the Depression was like. But what gets lost to history is the tiny details. That's what gets left out. So I've been asking her, what was food like? What did you wear? What was it like going to the store? Where did you get your news? All these little things that you're going to hear all the big stories about, the time you survived a car crash or the time someone pulled a knife on you. But you are going to miss those little things. What dating was like in the late 1920s. What happened if you were caught in a thunderstorm and you didn't have a rain jacket. So that's what I've been trying to do this time around. And it's actually been great at spurring some of those old memories that, bigger memories that she thought had been lost. So when you start asking, what was the floor made of in the cabin where you grew up, that spawns a memory that she had thought had been lost for 7 years. So I would recommend to anybody in the audience, who wants to speak to their elderly relatives, ask really small, kind of boring questions. And that's going to be the most effective, I found, of anything else.
Okay, so you sent me a list of things that your grandma told you about. And I just, because we have time here, do you have to go? Do you have anything you have to do in the next 10 minutes?
No, I know. My appointment is with Grandma to do another oral history session.
Okay, well, there's no way that I'm going to make you late for your time with Grandma Hopper, but I do have to get to.
No. She said, anything for Ryan Jesperson.
Oh,
whatever you need to do.
Okay, well,
Ryan Jesperson.
You tell Grandma Hopper thanks, and as soon as we have Jespo mugs, I will send her a mug, and I mean it. But you were talking about some of the things that you've learned from her, like. Let me reference some of these. The best time of year was when the communists showed up. What's that all about?
This one, I kind of knew this, but this one really surprised me. So she grew up in Rosedale, Alberta, just outside of Drumheller. And she said, the best times of year were Christmas, when, all the miners would get together and give up presents to all the kids in town. And then she said every summer, the communists would show up, the Communist Party of Canada, and they would hand out ice cream and hold foot races. And they didn't have a fair, but they did have communists coming to town. So I was asking, she was just a kid at the time. So I'm like, did they give speeches? I mean, what did they show up in like a big communist traveling roadshow? What did this look like? And she's like, I don't know. We just knew that communists came and we got to eat ice cream. So I'm like, that's very strange. I have not heard of this aspect of Alberta history. I actually thought we've never elected communists. Any open member of the Communist Party of Canada has never been elected in Canada because I think they were banned or something. So the fact that there was apparently just these communists driving around rural Alberta, handing out ice cream, which is ironic because if you look at the history of communism, not a lot of ice cream and foot races. It's mostly just gulags and starvation.
I was going to say, I of all the photos I remember seeing of the USSR, Romania, I mean, like whatever, through the years of the video footage we saw of the long bread lines, and I'm not mocking it, but I don't remember ever seeing a kid licking an ice cream cone, like trying to twist it so he made sure that it didn't drip onto the ground. That's not an image I would associate with communism.
Yeah. So not the image of communism. So to this day, my grandma understands communism was bad, but there still is, deep. And it's like a friend of mine. He has a mom who grew up in the Soviet Union, and she says she still has fond memories of Joseph Stalin. She understands he's one of history's greatest mass murderers. But when you're a kid and you're singing songs to Father Stalin in class, I mean, it's hard to beat that nostalgia out of your head. It's like, me thinking that The Goonies is a good movie. It's not, but, it's just stuck in there.
Yeah,
so
fair enough.
So anyway, apparently, so if anybody else in the listening audience has has experienced this weird, middle Alberta communist traveling roadshow in the 1920s, please let me know, because I haven't met anybody who's encountered this. There was a man. This isn't technically a swear word.
You can say whatever you want.
There was a man who moved to town. He was named Shitcaker, Herr Shitcaker. Moved there from Germany, and then tried to get along in the town until he realized that his name was Shitcaker, and then he changed it. So she didn't have a lot of context, but I do like to imagine this mustachioed German. Like, das is my name. It's a Shitcaker. It's not, why is you laughing? It's my name.
It's kind of like an endearing nickname. Like, I can see that if someone's like, hey, Shitcaker, bring over the, I don't know. I'm trying to think of what Germans eat. Sauerkraut? I don't know. That's what I can't think of.
Which that person's
Schnitzel?
descendants are probably in the audience.
Hey.
So their last name is like, Martin or something. Yeah. And if they do their family history, it's like Shitcaker. I didn't see that coming.
So your grandma this must be incredible, though, for her to be recounted. Like, for her, this must be a great, like, when she's telling you about Shitcaker, who she remembers 99 years later or 90 years later or however old she was, she must be getting a real kick out of these conversations with you, too.
Oh, yeah. It's also, I think so. Yeah. Because it is bringing back memories and weird memories. That's the thing is she said, I came back. So we did one session, then I came back and she said, I just remembered, when we first started this, I couldn't remember the names of any of my teachers. And then this one memory came back. And then with modern context, she realized like my grade 2 teacher was a total hottie. This was her memory. She's like, at the time, it's just your grade 2 teacher. But she started thinking about it like, long blonde hair, high heels, really good dress. Just looking back, this spurred a memory where I thought, like, for rural Alberta, grade 2 teacher in Rosedale, she was a total babe. And I'd never realized that before. So, there was more profound memories, but something like that.
This feels like literally every conversation I've ever had with Tristin Hopper. Yeah. Like, I was just like, oh, yeah, this is taking me back.
Have you had many?
I've had enough.
Tristin, this is Sam Brooks, the producer of this show.
Hi, Sam.
What's the story here?
Well, I mean, there's a couple stories. We used to work, when Tristin was based in Edmonton at a Post Media, he worked at the Journal building. So we got close.
Okay.
Like, yeah, we worked we were in separate places. Tristin is the guy that, because he worked for the National Post and
He was a bit of a
didn't
big
really
deal.
well, like, and he didn't really like. He was kind of an oddball in the newsroom, so he just took over the publisher's office and worked there.
Is that true, Tristin? That's gutsy.
No, I took over the publisher. I didn't go into the actual corner office, but the building is so empty. What people don't realize about the Edmonton Journal building is it was built at the worst possible time to build a newspaper building, because it was like 1991.
It's built to be a
pre-internet.
5-story newspaper empire.
Yeah, fair.
Yeah, so they built it with special foundations so it could be 10 stories eventually. So this is the emptiest building, I think, in North America. I basically had half of Florida. I would say easily I had 800 to 1,000 square feet to myself, which is good because I'm a very flatulent individual. So this is a good, time for me. But anyway, I think Sam had his own 1,000 square feet to himself, and I would visit him every once in a while, mostly for building advice. Sam is quite a talented DIYer.
He is.
You know what? I wasn't going to tell this story on air, but Tristin, you brought your dad to my New Year's party to talk to him about basement renovations.
So what he
That's correct. Yeah.
Tristin, you
actually,
wanted to use it as an example?
The hidden part of that is that we were visiting a relative who shall remain nameless. We had been at that individual's New Year's party in Edmonton, and my dad grew up in Edmonton, so we hadn't seen this person in quite a while. And I thought, oh yeah, see your old relative there. You guys were close growing up, and then I realized why they haven't spoken in 10, 20 years. There was a whole bunch of issues boiling under the surface that just completely exploded out in the open, and we basically had to flee. And I'm like, we just been yelled at, this huge, horrifying blow up. And I said, well, we can go to Sam Brooks' house and kind of get that bad taste out of our mouth. So we were refugees from this massive Hopper family, explosion. So that's why we were, with the 1,000-mile stairs in your basement.
Yeah. Before I let you go, and some people, this is not going to be their favorite part of our interview. It's not going to be their favorite part of the segment. But those that have grown up in rural, well, I better be careful how I tee this up. And I'm not sure if this is still the case, but you've indicated to me that Grandma Hopper confessed to you that not everybody in her hometown heeded Bob Barker's advice to spay and neuter your pets, including farm cats.
She said, and I'm imagining this is going to trigger some memories.
People will be upset about this.
She said, well, you didn't spay or neuter. So they said, everybody had a cat. But what you did, and this was standard practice, when the cat had a litter, you put him in a bag, and you drowned him. So if we looked at the bottoms of every creek in Alberta, it would be filled with tiny, adorable kitten skeletons. So apparently this was commonplace. Because you didn't spay, you didn't neuter. So the only alternative was thousands upon thousands of cats in the community, and no stray dogs too, which indicates to me they were just gunning down the dogs. So that's the thing about the past. The past is a foreign country. So you're always 3 follow-up questions from just something horrifying. It's like, oh yeah, there was this girl named Sally until she was euthanized. No, not euthanized, sterilized. But back in Alberta, you'd sterilize the
but actually, and like not that
actually would.
Relatively
the
speaking,
the definition of mentally unfit was kind of, she likes jazz. Better sterilize her. So there's, not for the past is not for the weak of heart. You are going to find some horrifying things.
I remember hearing the exact same thing from my grandpa who grew up on a farm, and it was like very matter of fact. Like he wasn't, and my grandpa's like a saint. He's like the most wonderful guy ever. And it was just like, people like, oh boy, I'm just going to open up a can here. But like, if you live and work on a farm, and we're very grateful to everybody that lives and works on farms, including my family members. And I'm not saying this is present day protocol at all. And I'm not speaking for any Jesperson family farm right now. But like 80 or 100 years ago, I mean, my grandpa didn't even tell me the story, Tristin, in a way that was like, you think that's crazy? Listen to this. Like it was not like that at all. But it was the exact same thing. Like, and I guess maybe now, I don't know, like, are we a little more, I don't know what to say, soft, like that we have animal rescues? I think we're probably just a little more civilized, but I don't think that it was your grandma's community that was the outlier here. I think that was just kind of like how people rolled.
I think everyone did that. This was,
the
more I've brought it up, and yeah, I wouldn't recommend this at most parties. People object to the kitten drowning talk.
Yeah,
but the more I brought it up, in my surprise, they say, yeah, that was how you dealt with cat population. So I think if cats knew that, they probably wouldn't be hanging around us as much.
Yeah, I agree. I agree. They'd probably actually be rallying against us. Cats, to me, they have that look. Like, I'm more of a dog guy. I understand why people love cats. Cats are cool, but to me, a dog would never cut your throat in your sleep if it could. A cat might. And I get a little more nervous around cats than dogs.
So it took us 3 weeks to just turn real talk into cat talk.
Well, I mean, we can do cat talk, dog talk, whatever you want. All I know is this, Tristin, there are more people watching us now than when you started, which is a good sign. However, our comment section, as I'm seeing now, is devolving into conspiracy theories about 5G and a whole bunch of other interesting things. And I'm not going to pin that on you exclusively. What I will say is that it's great to get you back in the fold here.
We all have our favorite conspiracy theory.
What's your favorite?
Mine is that Bob Dylan died in 2008 and the record producers covered it up to keep making money. That's why he wears the big hats. It's not Bob Dylan.
It's like Melania Trump 2.0 kind of thing. Like there's an imposter. Okay. I don't have one off the top of my head. Do you have a conspiracy theory, Sam, that you think might be true, or do you have one that's?
I don't have a favorite conspiracy theory. I'm not convinced we're the smartest animals. Because we're too dumb to know it. There's probably a species smarter than humans.
Who do you think it might be?
Dolphins are a good candidate. It might actually be like a bacteria or something we haven't even discovered yet. You know what I mean? Like it's just they're so much more intelligent than us that they just don't even have the time to deal with us.
They're just waiting till we're vulnerable, and then they're going to take us out. This is more for our Buzzed podcast, which we may be launching, Tristin. It's going to be like a 1 to 3 in the morning type podcast. We're basically going to...
Okay.
We're doing this at 1 in the morning.
We're going to stuff our faces with psilocybins, and then we're going to wait a half hour, and then we're going to start podcasting. And we'll invite you...
Well, here's a whale thought to go out on. So especially because here on the West Coast, everybody loves the whales. They love the dolphins. They think they're smarter than us. They're free. If they got the oceans to themselves, I wish I could be a whale just outside. What people never consider is that whales spend most of their lives over a black abyss. So you just look down and you just see nothing down there. Now, if anything happens to you, just think of all the times you sort of sprained an ankle or fallen down or collapsed, or maybe you had a mild stroke or a mild heart attack and you needed to be hospitalized. If that happens to a whale, they just fall into the abyss as their family watches them disappear. So I'm going to take humanity over whales. And imagine just the mythology they have around that. It's like,
because we all have that choice to take one or the other.
He fell into the abyss. Yeah, he's sort of like, my neck's killing me. And then fell into the darkness. Like and then they never saw.
But I'm picturing Jack. I'm picturing Leo DiCaprio, like slowly dropping in fate. And there's actually something quite hauntingly beautiful about it, in a way.
Yeah, because he's not screaming.
Fair.
Yeah, he's already dead. But the whale's like, there's so much more to live for.
On the YouTube live comments, Epiphanies of Tiffany says, y'all are blowing my mind, which is great. Marie believes that Elon Musk may be an alien. Michael Wilson says that's not a theory, that's a fact. Others say, let me see here. These are some good ones. Judy believes that Tupac still lives. He faked his own death. Scott says Jesperson, the Melania one, that is true. Michael Wilson says, I saw Dylan in 2012 and it was terrible. I buy that conspiracy. Jess believes that Michael Jackson may be alive and well in Quebec. This is well, and how about this from Lisa Holmes, the former president of the Alberta Urban Municipalities Association, former mayor. Lisa's just an incredible human. Glad to see she's watching. She says it's sad about what Tristan's saying about the farm cats, but it's completely true. She says, my grandmother lived with a real phobia of cats, jumping on tables. She'd jump on tables if she saw a cat anywhere, and she related it to seeing and remembering her dad drown their kittens. That from Lisa. So interesting stuff. Tristin, I didn't think we'd be talking about that this morning. But then again, it's not the first time that you and I have allowed our conversation to, let's say, meander in entertaining ways. It's a thrill to have you here on Real Talk. I can't wait till we can make things official with your employ and talk about that. We'll be eager to read you again, nationally speaking. Say hello to Granny Hopper for all of us here, and have a wonderful day in beautiful Victoria, BC. Thanks for spending some time with us.
Thanks so much. Enjoyed it thoroughly.
That's Tristin Hopper, soon to be back with, I'll be honest with you, hon, I did not know that he had not actually signed a contract with the National Post. So in my announcing that he's back, I sure hope that that happens. Otherwise, I mean,
Postmedia's lawyers are breaking down our door right now.
yeah, he'll get picked up somewhere else if they don't take him. What a show this has been. And thank you all for your commentary. We've covered a lot of ground today. What I do want to remind you is that today we have a very special edition of Real Talk coming up later today. That's right. Sam and I aren't going anywhere. That's because at 2:05 Mountain Time, 4:05 Eastern Time, we'll be sitting down for a one-on-one exclusive interview with Canada's Finance Minister, with Deputy Prime Minister Chrystia Freeland. It'll be live again at 2:05 Mountain Time, 4:05 Eastern. All you need to do is meet us right back here on our live streaming YouTube channel. You can listen to it on Mixlr. You can find all of those links at ryanjesperson.com. Again, we'll be live coming up in another 3.5 hours or so at 2:05 Mountain Time. And, of course, we'll be podcasting that as its own separate entity. Thank you for being part of the conversation today. I know I don't need to tell you that the conversation will continue on Twitter. Just use the hashtag RealTalkRJ. That's oftentimes where we get ideas for upcoming shows. The best way to tell us what you'd like to hear more of or where you stand on an issue is to sign up for the question of the week at ryanjesperson.com. Join our Real Talk panel. We look forward to talking with you again soon.
They're gonna